The CDC has issued a warning about a significant increase in walking pneumonia cases among children. This surge is noticeable in children aged 5 to 17. Parents should be aware of symptoms and seek medical attention if needed. Walking pneumonia spreads through respiratory droplets. Close contact in schools aids the rapid spread of infections. I don't think people understand why there's a recent surge in walking pneumonia cases among children. While the exact reasons for the recent surge in walking pneumonia cases are not fully understood, experts believe that several factors may be contributing to the increase. One prominent theory is the impact of pandemic lockdowns on children's immune systems. During the COVID-19 pandemic, lockdowns and school closures limited children's exposure to common germs and viruses. This lack of exposure may have resulted in what experts call an immunity gap, where children's immune systems have not had the opportunity to develop the necessary defenses against common pathogens like Mycoplasma pneumoniae. As a result, children may be more susceptible to infection and more likely to experience severe symptoms. In addition to immunity gaps, other factors may be playing a role in the rise of walking pneumonia cases. These include the relaxation of COVID-19 mitigation measures, such as masking and social distancing, and the increased prevalence of other respiratory viruses, such as RSV and influenza, which can weaken the immune system and make individuals more vulnerable to secondary infections like walking pneumonia. Walking pneumonia often presents with mild symptoms, making it difficult to distinguish from other common respiratory illnesses. It's crucial for parents to be aware of the signs and seek medical attention if their child exhibits any of the following: persistent cough, fatigue, headache, low-grade fever, difficulty breathing, chest pain, and loss of appetite. Section 4. Early detection is key. Seeking timely medical attention. Early detection and treatment of walking pneumonia are essential to prevent complications and ensure a swift recovery. Parents and caregivers who suspect their child may have walking pneumonia should consult a healthcare professional promptly. A doctor can assess the child's symptoms, perform a physical exam, and order any necessary tests to confirm the diagnosis. Diagnosis of walking pneumonia typically involves a physical exam, review of the child's medical history, and a chest X-ray to look for signs of lung inflammation. In some cases, the doctor may also order blood tests or a sputum culture to identify the presence of Mycoplasma pneumonia. Treatment for walking pneumonia typically involves a course of antibiotics, usually azithromycin or erythromycin, to eliminate the bacteria. Over-the-counter pain relievers and fever reducers such as acetaminophen or ibuprofen can help alleviate symptoms like fever and headache. Rest, fluids, and a healthy diet are also crucial for recovery. Section 5. Preventing walking pneumonia, hygiene, and general health tips. Preventing the spread of walking pneumonia and other respiratory infections like it requires a multifaceted approach that includes good hygiene practices, vaccination, and other healthy habits. Parents and caregivers can play a crucial role in preventing the spread of walking pneumonia by teaching children about these preventive measures. Hand washing. Frequent and thorough hand washing with soap and water is one of the most effective ways to prevent the spread of germs. Children should wash their hands for at least 20 seconds, especially before eating, after using the restroom, and after coughing or sneezing. Respiratory etiquette. Teach children to cover their mouths and noses with a tissue or their elbow when they cough or sneeze to prevent the spread of respiratory droplets. Used tissues should be disposed of immediately in a trash can. Vaccination. Ensure children are up to date on all recommended vaccinations, including the flu shot and the pneumococcal vaccine, which can help protect against some types of pneumonia. Avoid close contact. Encourage children to avoid close contact with people who are sick, especially those with respiratory symptoms like coughing or sneezing. Section 6. A call to action for parents and caregivers. The recent surge in walking pneumonia cases among children is a cause for concern, but it's important to remember that this illness is treatable, and most children recover fully with appropriate medical care. By staying informed about the symptoms of walking pneumonia, practicing good hygiene, and seeking prompt medical attention when necessary, parents and caregivers can help protect their children and prevent the further spread of this contagious respiratory infection. Parents and caregivers are encouraged to contact their child's healthcare provider immediately if they suspect their child may have walking pneumonia or if their child's symptoms worsen or do not improve with home care measures. Early detection and treatment are crucial for preventing complications and ensuring a full recovery.